Researchers at Johns Hopkins have turned the contemporary view on osteoarthritis upside down. Instead of seeing the painful degenerative disease as a problem primarily of the cartilage and cushion joints, they now have evidence that the bone beneath the cartilage is also a primary player and can exacerbate the damage. In this proof-of-concept experiment, they discovered that blocking the action of a critical bone-regulating protein in mice blocks the disease's progression. Lead researcher Zhu Cao claims that degeneration is most often caused by instability in the load-bearing joints of the knee and hip, caused by injury or strain. So athletes, overweight people, and people whose muscles are weakened are at highest risk of developing osteoarthritis. The prevalence of the disease is rapidly rising. It currently impacts 27 million Americans and could double by 2030. The only treatment available is pain management or surgical replacement of the arthritic joint with a prosthetic one. Using mice with torn ACLs, which are known to lead to osteoarthritis of the knees, the researchers found that as soon as a week following the injury, pockets of subchondral bone had been eaten away by cells called osteoclasts. This process triggered high levels of a protein in the bone that recruited stem cells to the site so they could create new bones to fill the holes. But the bone building and bone destruction mechanisms were not coordinated in the mice, and as a result, bone building prevailed, placing a greater burden on the cartilage cap. It is this extraneous bone formation that Cao and his colleagues believe to be behind osteoarthritis, as confirmed in a computer simulation of the human knee.